Good evening, everyone. This is Bishop Ernest McNear. I have the honor of being the president of the Board of Directors for Philadelphia White Community. I want to welcome you to our 30th anniversary conversation. Normally we having a big gathering, a gala, and talking and fellowshipping, but you're aware, I'm sure, of COVID-19, and so we have to be a little bit more creative. So we want to bring it to you tonight, conversation. And I do mean conversation about Philadelphia Fight and all the wonderful supporters and the team at Philadelphia Fight, everyone who has helped us to go forward in our mission. That mission is to see a cure for HIV and AIDS during our lifetime. But I want to welcome you and I want to thank you. But there's much to talk about tonight. There's been many, many accomplishments. There's been strides like never before fighting this virus of HIV. And it's been done because of your help, your support, and your activism. I want to just bless all of you that have been our partners during this time, and especially those who have been affected by HIV AIDS. Thank God for you. We love you. I don't want to take up too much time. So let me tell you what we're going to do. I'm going to introduce to you two important people, and you'll be glad to hear from them. I'm going to introduce them to you, and they're going to have a conversation, and it's going to be interactive. You'll be able to join in after hearing some of the things that we've done and some of the things that's going on, some of the challenges and victories. And after that, you'll be able to ask questions and add in whatever things that you know about and want us to know about. But I truly want to just thank all of our supporters, all of our workers, staff, medical staff, everybody, education, everything, because without you, we could not have made such strides. We couldn't be celebrating, and we are celebrating. As you listen, you'll hear what we're celebrating about. But right now, let me just bless and thank you. Let me say this short to help us as we go. Father, now, God, we do thank you for this time you've given us. Thank you for the 30 years that you've given Philadelphia, many partners and scientists and researchers and all of the supporters and the magnificent. Oh, God, bless them, keep them, and anoint this meeting. We conversate, be in our midst, and let someone be edified and let them be inspired. You to go on and do what you've given us to do. Thank you, Lord. And we pray. Amen. First of all, I'd like to introduce our Chief Executive Officer. You're, I'm sure, aware of her. If you're on this Zoom, you're aware of her. I don't think she gets the kind of credit that she should, because she is an innovative leader, fearless leader, in going places with and fight to places that we haven't been before. We'll hear more about that as she conversates, and that's Jane Shull. Thank God for Jane Shull. And I'm so blessed to be a colleague, a worker with her under her leadership, CEO. But also we have a guest with us that's been with us before. She's an activist in her own right, but more than that, she's a reporter for KYW, and she's been with us to help celebrate year after year. And we thank God for Sherry Gregg. All right. And so what we're going to do, I'm going to turn it over to Sherry Gregg and Jane Shull. And as they conversating, we can listen in. Then you get your questions. And then you will be able to join in after a little while. Again, I thank all of you for being here tonight to celebrate 30 years combating HIV and AIDS. And as I said, we've made great strides. We're not just HIV and AIDS now. We're health centers. So I thank God. And I'll turn it over to Greg and Jane Shull. God bless you.
Thank you so much, Bishop McNair. We really appreciate your leadership as well. And that was a wonderful prayer. Good evening, everybody. I'm so excited to see so many people here with us virtually. Hopefully, in the near future, we'll all be able to gather again soon. I gotta say, congratulations to FIGHT. I know we can't see each other, but if y'all could give a virtual round of applause to FIGHT and the entire team for 30 years of hard work, bringing healthcare and fighting the HIV epidemic, and year after year after year. Super round of applause. As Bishop McNair mentioned, you can provide comments, use the chat. I will read out and shout out some of your comments during this one-on-one conversation with the one and only Jane Shull. Jane, how you doing?
I'm good, thank you. And Sherry, we really appreciate you.
My absolute pleasure. 30 years.
I know.
Hard. Does it feel like 30 years, Jane?
Well, it feels like 60 years this year, but other than that, it's hard for me to really think, wow, this has been 30 years.
I know COVID years are like 10 years in 1 year.
Right.
And so I know let's go back, Jane. Let's because a lot of people probably came into the fight at different stages and joined this team of activists. And so let's go back. Let's rewind, because I know you've been a part of the FIGHT team almost since the beginning, not quite since the very beginning, but could you give us a little bit of the story? How was FIGHT founded?
So we were founded, we were incorporated in 1990. And it is really important to remember that at that point, we didn't have effective drugs. We had drugs, they weren't really very effective. The numbers were still going up and up and up. There were strong, serious limitations on social services and so on. And what happened, the way FIGHT got started, was that the American Foundation for AIDS Research, which for those who may not be familiar with it, is exactly what it sounds like. Dr. Mathilde Krim founded it to try to look for effective treatments and ultimately a cure. The American Foundation for AIDS Research put out a call for community-based research organizations. And the reason that they did that is that the other thing it's important to remember is the big medical centers didn't really want to touch AIDS. They thought it was a money loser. They thought that, that they didn't want to be identified as the AIDS hospital and all that. So AmFAR was really encouraging doctors in the community to form coalitions to actually do research, clinical research, research in new drugs, research in people. So Dr. John Turner, who was an endocrinologist, but also a gay man, and so when AIDS came along, he just felt he needed to step forward. He decided to apply for one of these grants. And unfortunately, Dr. Turner passed away several years ago. And the other person who was involved in this also was John Lax, who was the founding president of our board, of our community board, who also sadly is no longer with us, in his case from AIDS. But there was a pretty strong feeling that we could do this. And so between John and me and John Lax, we wrote this grant, and AmFAR gave us the grant, and then, we just got started. So in the beginning, it was a really tiny organization. We were doing research in drugs, we had 3 staff members and we had 4 staff members, but people were really determined that we needed to end this epidemic. And, we still have that tagline, but, we've been trying to work on this, all this time.
Yeah. And so there's been pivot moments and expansion moments. And so how did FIGHT go from this tiny little team with this focus, the singular focus, to now becoming a leading healthcare center that does more than just HIV and AIDS work?
Well, so we expanded in different ways. I mean, one very important thing that happened was that in 1997, we formed the Lax Center, which was named after John Lax. Before then, we had only been doing research, and John felt very strongly that we really needed to form a treatment center. And the reason he thought that was that he believed that there really wasn't access to good care. There was not decent access, and a lot of people just didn't have access. And he had been saying this and saying this and saying this and saying this. And, you know, like, I wasn't sure that we could do it. Nobody was sure we could do it. But then, you know, when John died in 1996, what happened was he left us money with which to start a treatment center. So it's kind of like, okay, this is an instruction from beyond the grave. We got to do it. So we treated that money as a seed grant. We started seeing patients in 1997, and, you know, that kept growing. And there's, you know, like around 2,000 people now with HIV who we take care of. So that was one thing. There's kind of another very long story, but to try to really compress this, we started Project Teach, which has been doing education for people living with HIV and then educating other people about HIV around the same time. We took in the programs of what used to be the AIDS Library and now the Critical Path Learning Center in the late 1990s. The Institute for Community Justice, which works with prisons and ex-offenders, started only working with people with AIDS, but now works with people, with citizens returning from prison or jail, and they're inside the prisons, sort of around 2000. So we kind of just kept adding programs because there were needs in the community. So ICJ started specifically because a lot of our patients were part of this revolving door of incarceration. And we realized that, you know, they weren't getting effective treatment inside the walls. So it started with advocacy, and then we created, you know, social services at ICJ. So, you know, there were a lot of things like that. And then finally, the other really big jump was that in 2013, really at the end of 2013, we became what's called a federally qualified health center, which is to say a community health center. And the reason that we did this is because thing about the AIDS epidemic is that, you know, David Fair, who I think probably a lot of people who are on this call know, you know, David Fair came to one of our big conferences, what we call the Prevention Summit, 20 years ago or something. And he said, you know, HIV is a virus, but the pandemic is caused by poverty, injustice, and despair. And we have been using that line for many years with appropriate credit to David. And that's true, you know, and there's not a separation there. There are many people who were living with the same issues that many of our patients were living with, like history of incarceration, homelessness, being a young gay man, not sure of your sexual identity and therefore taking a lot of risks and so on. We want to be able to help those people too. And so we became a federally qualified health center in 2013. And so we're now 3 times the size we were from the point of view of patients. And, you know, we've grown, you know, to offer all sorts of other programs. So,
yeah. And I got to mention this because this is one thing that stands out to me whenever I go to the FIGHT website is that you all provide culturally competent care. I think that is a line, and that kind of goes back to the very original mission of FIGHT and has continued as you expanded. Could you explain that a little bit?
Yeah, I mean, I think we believe that everybody has the right to receive treatment from someone who they will feel comfortable with, right? Who they will feel that they will understand them, will understand who they are. And so that's a couple things we try. We try always to have the most diverse workforce that we can have, but we also think it's important, you know, to train our staff to understand that, you know, every person who walks through our door is a human being, everybody, regardless of where they came from, regardless of who they are, you know, everyone who walks through our door. And we want people to, you know, we want people to feel comfortable. We want people to feel like, you know, they can trust that the person who they're looking at will be somebody who looks back at them and sees them as a human being. And even, you know, most recently, we have been we've been doing COVID-19 testing throughout the city, which we'll probably get to a little bit later. But something that's very important about that is that we kind of sort of fell into this, but there's very little COVID testing available with Spanish language competency around the city. And so when we realized that we were really, for various reasons, you know, we were kind of the only sites, we made a point of making sure that when we hired the site manager, that they needed to speak Spanish. And that we needed to have volunteers as well and partner with organizations. You know, you need to meet people's needs.
Yeah. And we're going to talk about another little history tidbit in a moment that people may not know about. But I want to sort of talk about this whole pivot because, you know, FIGHT began working on getting rid of HIV and AIDS, still doing that, has expanded to do broader healthcare services. And then the country gets hit with a pandemic and FIGHT rises to that occasion as well. How has COVID-19 changed the work that FIGHT does?
Well, it's changed the work in our clinics a lot because we've had to make tremendous changes with how we practice medicine, right? Because, you know, this unlike AIDS is, you know, it travels through the air. It's like it's a highly infectious disease. And so in those ways, we went to almost complete telehealth during the very early part of the pandemic, and we're about to go back to a lot more telehealth now because, of course, you know what's going on worldwide, but also specifically in Philadelphia, is we have the highest numbers we've ever had, more than during the spring. And so we reorganized. We send people who might have COVID only to one of our clinics. We send people who might not to the other one, regardless of where they had been. You know, we had to set up 143 computers at people's houses or somewhere so that they could work from home, even part of the time, you know. So we've had to do a lot of things like that. We also have had to buy a lot of what they call PPE, personal protective equipment, which I feel is really important to mention since, you know, we're putting out an appeal for that because our doctors can't walk into somebody's exam room unless they, you know, are kind of covered head to toe. One of the things that I think is the most interesting is what our dental clinic did. Because what happened was the state at one point closed all the dental clinics. They just said nobody can practice dentistry in effect, because if you didn't have certain equipment, which nobody has, you couldn't, and they changed that pretty quickly. But what we discovered is they could even do dentistry through telehealth. And how could they do that? Well, because people who have an abscess or in a lot of pain, you can actually help them for a while with painkillers and antibiotics. And then by the time the course of antibiotics was over, almost all the time we had figured out a way, you know, that they could come back in. But you know, so we have these giant HEPA filters that cost like $5,000, and we have sort of vinyl sheeting because we had the open bays, and now we can't do that. Luckily, the dental practice is in a building where they can open the windows. So that makes it a lot easier. And we believe that people are probably safer in our practice than they actually are in most private practices. Because that's, you know, like a lot of sort of things like that happen. The other thing that happened, and I just think this is so much like, you know, the way we just do things, is our COVID testing program. So we have a COVID community testing program, and started out being in one site. Now I think we're in 6 sites, and the director, who I've been sort of trying to say, don't do this, but nevertheless, we'll probably open a couple more sites. We're in low-income neighborhoods, you know, where we're in North Philadelphia and various places. We're in Kensington, we're in South Philadelphia. And what we're doing is we are offering barrier-free COVID testing, meaning you do not need an appointment, and you don't need an appointment. Nobody's ever going to get charged a dime. You don't need a prescription, and we will test you for any reason. And as far as I know, it's us and the Black doctors. I don't think there's anybody else who's doing that. And why is this important? It's because a lot of times people need to get COVID tests in order to go back to work, or they need to get regular COVID tests. last summer, there was something that happened when the Puerto Rican government put out some kind of advisory that people needed a COVID test before they went there.
Yeah.
And a lot of people travel to Puerto Rico in the summer to take care of their houses and make sure, they're ready for hurricanes, and they couldn't get tests. So, but we were testing people. So, we're trying to do with, and so I think we've tested, I actually sort of had this, as I would remember what the number, we've tested about more than 4,000 people, and the numbers are just, really, now the numbers are starting to really shoot up. We also will test children. I mean, so we're kind of doing this, and this has happened in relationship to many different partnerships throughout the city. For example, CMAC, Norris Square Civic Association, Face to Face in Germantown. We're testing also at Dobbins in North Philadelphia. We're doing this through partners who can help us publicize, and who can, already have the community trust, so people will come to us.
Yeah. Yeah. And I have to say that the no barrier testing is critical, because for so long, and I can tell you this, I got sick in March. It was so difficult to even be able to get a test. So having a place where you can go and know you can get a test is an amazing accomplishment, and kudos to FIGHT. And let me just read to you, Jane, some of the comments here. You got a lot of, Moore College of Art and Design congratulates you, the board, volunteers, and everyone at FIGHT for this important milestone. Luz Colon says, I'm so proud of Philadelphia FIGHT. The Colors Organization says, congratulations. So many people giving shout outs. The Desi Group congratulates FIGHT. I saw some of your other folks, the Department of Prisons here, say, they raise their hands, they're clapping. So you have all these partnerships that have been sort of fueling FIGHT throughout the years. And so I do want to pivot, Jane, because, there's a lot of anniversaries, 30 anniversaries, but there probably wouldn't be a FIGHT if it wasn't for the civil rights movement. And the civil rights movement was directly responsible for the creation of these community health centers, something I did not know. Could you explain how that movement sort of tied to to centers like FIGHT?
Yeah, I mean, and I didn't know this until fairly recently either. We obviously have a lot of roots in AIDS activism, but this community health center movement also did have its roots literally in the civil rights movement, and specifically during the summer of 1964, which was Mississippi Freedom Summer, and there was a call that went out for volunteers to come to Mississippi to support voting rights for African Americans. And everyone knew before that summer started that all of these volunteers and the local people, probably even more so, were in great danger the whole time. And so a call went out to doctors throughout the North. And, there was one doctor specifically who was in Mississippi. He was a Black man who had trained in the North and then went back down south to come to Mississippi. And they created mobile clinics, and it was on the model of the South African mobile clinics that had been created during the apartheid struggle, where you had a clinic, there's a demonstration, people go there and they can get treatment. These doctors were all denied licenses by the state of Mississippi, which, if you know the times, not particularly surprising. But they created this, and then at the end of it, they all kind of looked at each other apparently and said, well, now what do we do? And so they started forming national organizations. Some of them realized, well, what we need to do is form what was then the free clinic movement. I would say that in general, the people in the FQHC movement, most of them, if the economics were such that we could just be free clinics, we would be, but you can't do that anymore in America the way it is. And so these clinics started, and the principles that, we learned or came from or whatever during AIDS, in terms of one, respect for the individual, but secondly, an understanding that health is very inextricably wound up with, do you have a place to live? Do you have enough food to eat? Do you have opportunities for jobs? Are there ways for you to stay out of jail related to all these other things? This was part of this. This was part of it from the very beginning. And so it's an important history that I think it's a really important history for us to honor.
Yeah, I love that tidbit there. I don't think a lot of people knew that. And I want to shout out to everybody who's here. If you have questions, you can submit them via the chat or through the Q&A feature here on Zoom. And so thank you for that knowledge, Jane. And I want to talk about this PPE because there's a shortage.
Yes.
Yeah, explain what that is. And I know you guys are trying to raise PPE, money for PPE.
Yeah, so there's a shortage, and of course the effect of shortage is the prices go up. So that's what we're dealing with. So what you're talking about is face masks, gloves, goggles, face shields, gowns, and in some more extreme cases, booties. And what happened when the COVID epidemic started was that the important kind of masks that a medical professional needs to wear, which is called an N95 mask, immediately became, great shortages just started immediately. And, in the very beginning of this, people were sort of passing on to me, some of the memos that were being, circulated at the major hospital systems talking about, the thousands and thousands of masks that they were going through. And it wasn't as bad here, but it's bad when you can't have adequate supplies. So, our dental program is recycling. Our medical programs, as everybody has been doing, instead of having one per patient, that was the standard before this. Instead of having one per patient, they're having one per day. And that's, this is bad. I hear that there's shortages now of the neutral gloves or the other non-latex gloves, particularly in size medium, because that's the size most people are. So this has been a continuing problem, but it's also a continuing problem because the price has gone up. And, we have people who do nothing but buy stuff for us at this point, or do, it's like they're spending all their time just trying to find it. And I don't think anyone knows what is going to happen in the future. And of course, we all know, and we do want to, I think it's important to recognize that this is one of the many things where none of this had to happen. The fact that there was a complete lack of national leadership, and it became every person for themselves is the reason, or every institution for themselves. And there were stories of people from hospital systems where, it's like one guy that we heard about went to meet the trucks when they left one state and went into another. And it was lucky that he did, because somebody else was there trying to divert them. I mean, it's ridiculous. In the beginning, the assignments within the state, were sucking it all up, and it was only going to the hospitals. And we were fortunate that, many of our elected officials, and also there's an association of community health centers, were willing to write some letters and try to get that fixed up. But anyway, so at this point, but this is the thing, we have there's a donation pop-up now on our website, and we're focusing on PPE for the month of December, started on World AIDS Day. And the important thing about it is that there is no donation too small to make a difference. Even if a person could only afford to help us buy one or two masks for a couple of dollars, but of course people can give us more, and it absolutely can be used. But we were paying amounts like $50,000 a month early on this, and and I don't know what will end up happening now, but it's it's usually expensive, but if you don't have it, then there would be no way to keep everybody safe. No way.
Yeah. And I got Kathleen Hooker, she asked, what is the best way for us to support the work of FIGHT? Should we donate PPE?
Well, we're happy to accept donations of PPE, and we have received donations from from several companies, sure. Or you can go on the website and just donate to this fund, and the fund is separate. All of this will just go to PPE.
Yeah, and the website link has been put in the chat multiple times. You have a lot of folks saying congrats on 30 years. That comes from Gary Hines. Zach Wilka says congrats from the board and staff of the IBA on 3 decades of transformational vital work. You got thank yous from Andre Ford and the Colors organization, from Chris Bartlett and the William Wade Community Center. So many people from the Moore College of Art, Bruce Herdman and the Philadelphia Department of Prisons. So many people talking about saying thank you, from Ewing Cole, extends a heartfelt congratulations to Philadelphia Fight. Folks have said, Jane, that that Fight has saved their life, literally. When you hear stuff like that, how does that make you feel?
Well, it makes me feel very good. I mean, I used to really say to people, because, AIDS is hard, right? AIDS is very hard. A lot of people die and so on. But the two things about it are that you're doing meaningful work if you're working in this field. If you're helping somebody with AIDS, and now we're helping somebody be cured of hepatitis C too, which is another major program. And secondly, I mean, like, where else could you be where people will come up to you on the street and thank you? And they do. They come and thank, members of our staff, me, so we really appreciate the support from everybody. And there's many of our friends and allies long-term, are on this call and are putting into the chat room, because, nobody's doing this alone. I mean, we're all doing this. We are all doing this together. And there's, Fight would never have happened without the support of many people, some of whom I was able to name, but, sort of many more people. I mean, like, notably, for example, Dr. Karam Mounzer, who for many years was our medical director. And I think his presence here was the difference between our being, somebody who was maybe a little more forgettable, and, and the reputation, and what we have now, which is the reputation everywhere for excellent care. There's just many people. Many of the people who've been on our board, including Bishop McNair, for many years, who've just been here and who've supported us through this.
It takes a village. Senator Tartaglione's office says congratulations. Also, shout out to Rhonda Goldfein of the AIDS Law Project. Lots of folks here. And again, you can go to fight.org. Jane, if you were to look back and say, okay, these are some of the accomplishments that, the Fight team, we're proudest of these, or that these were turning points in Fight and in Fight's mission, what would those times be?
Well, I think going back first to our research agenda, one of the things that I'm proudest of is the partnership that we have had with the Wistar Institute for many years, starting in the mid-1990s, I mean, almost as long as Fight has been in existence. And because of, there's been this sort of scientific question all along between one team whose perspective, it's like people would say, it's the virus, stupid, which is a reference to when Bill Clinton was running for president, James Carville's campaign manager had a science, the economy, stupid. So it came from that. It's the virus. And then there's kind of the other team, which we've been part of, which is, no, we need to think about the immune system. And so we have been working on boosting immunity with them, since the mid-1990s. More recently, for the last few years, President Obama put a lot of money into research for an AIDS cure. And for, a period of time before then, no one was willing to talk about cure. You would talk about effective treatment. It's like diabetes. It never goes away, but you can treat it. We're talking about cure now. And I think that beyond a doubt, because of us and them, Wistar Science, and our resources and our ability to have staff that was able and willing to help patients understand the importance of these trials, and our patients who were willing to participate in the early trials and the more recent trials, I think there's going to be a cure. And we're part of that. There's just no question we're part of that. And it's sort of an example of, well, start 25 years ago and keep working on it. And, it's not only us and Wistar, there's now a huge international partnership under the leadership of Luis Montaner at Wistar. So, this is like a very big deal. And it's the part of what we do that is, totally true to, to our roots. I think the second thing is that we have built an AIDS project, and we are an AIDS practice, and we were building other practices in Philadelphia where the care that you get, no matter who you are, racially, by your gender, economically, socially, if you're LGBT, if you're straight, it is as good as the care you can get anywhere in America. And I think that's, that's like a huge accomplishment. It's as good as the care in academic medical centers, and they would say that too. And everybody is treated with dignity and respect. I think that, that's really an important thing that we did. And then I think another really important thing that we've done over the years is that we've nurtured and encouraged this really enormous educational outreach system that we have. Project Teach has probably graduated 4,000 people or something, from, nobody was counting in the early years. So basically nobody knows the total, but Project Teach has probably graduated about 4,000 people from its core class, which is for people with HIV. And we have seen all of these people come and take this class and really, commit to it. And as a direct result, they have been able to take over, they are real active participants in their care. And, that seems obvious now, but, well, it's not obvious like in the 1990s. So, and now we don't just have Project Teach, we have Youth Teach, and we have Women's Teach, we have Faithful Teach, which is for people from faith community. We have Teach Outside, which refers to outside the prison walls. At different times, we've had teachings conducted in Spanish and so on. This is like enormous. A more recent accomplishment is that we've grown what was the AIDS Library for many years into the Critical Path Learning Center. And we also took the education programs, and it's now the Community Health Training Alliance, which is, their logo is sitting up there, because we do health training now. We don't just do AIDS training. And, this was an important expansion. It's called Critical Path because of Kiyoshi Kuramiya, who was another towering figure in the AIDS world, who was an AIDS activist and many other things, but whose newsletter, Critical Path, was the first AIDS newsletter that was really aimed at consumers to give them all the information they needed. But then, in the mid-1990s, Kiyoshi gave the AIDS world the internet. He did it. Yeah. And I remember that, there were international AIDS conferences, in the beginning of, the internet, where there were all these activists running around, and they were always at the right place at the right time, and they were communicating with each other. And none of the scientists understood why. It was because they all had email at a time when actually very few people had email. I mean, so Kiyoshi was a very important figure. We have been doing we're doing community COVID testing now, but, we've been doing HIV testing in communities for many years. And we have been willing to, part of why we got involved in this is we felt that it was really important that people with AIDS be among the people doing the testing, because when a positive test comes, if the person who did your test was someone who can say, look, here I am, and I'm not just surviving, I'm thriving, I'm working, you can too. And we've continued to have people living with HIV as part of our testing team and go, it's like, obviously there's a lot of limits to what you can do now because of COVID, but this will pass. And people will be able to, to go out again and do that. So, that's been, that also has been a very important part of who we are. And then, of course, the Institute for Community Justice, which I think has really become a force, in movements against mass incarceration. And who, we have people now who come out of prison or jail and they were adjudicated to our programs, and many alliances and so, So I think all of this stuff, is, I would say, unusual for someone who, for some entity that's a health center, but this is who we are, and
this is who FIGHT is. Yeah. And I want to say congratulations again. I'm gonna read a couple more of these before I give you the final word, because we're about to wrap up. But I mean, FIGHT has done so much. And, 30 years is I mean, it's not that long to have grown and done so many things, and to still be fighting strong in Philadelphia. And we appreciate you. So let me give you a couple more. They said, Mark Seaman brought up the fight was a leader in getting PrEP into the mainstream. We can't, unfortunately, I mean, if you want to, in your closing remarks, talk about PrEP a little bit, that would be great. Len Farber is here, from Director of Career Engagement in the Geisinger Commonwealth School of Medicine. Mark from the Stanley Foundation. We have so many people here. People are saying, thank you so much, Jane. There's even emojis with hearts and all sorts of things here. So I want you to take a few moments, give final words as we wrap up about what all of this means. 30 years of hard work and hopefully 30 plus more to go.
Yeah, I mean, I think the thing that's probably at some level the most important thing is that, we were part of a movement, and I think we still are part of a movement that, I always say this when we have teach graduations, that this is where, yes, 30 years is not that long. And AIDS has been around for almost 40 years. And 40 years is not that long for there to be, 35 or 40 or whatever it is, drugs that do effectively treat AIDS, where for treatment regimens that are simple and no longer make people sick, like the days of, 20 pills, on each of them on a different schedule, you could eat or you could not eat, and they would make you sick, are gone. Where we now have, it's like major television networks or run commercials with people, and it's like AIDS doesn't define me, sort of upbeat music, all this would have been completely unheard of when this started. And I think that it's very important always to honor the people who are, really responsible for this, which is the people living with HIV who in the early years of the epidemic refused to lay down and die. And they said, no one says AIDS victims in the media, as they are people with AIDS, they're activists, they're advocates, they're consumers, they're people with rights, and they got together and they really did change the world. They changed within AIDS the relationship of doctor to patient. Tony Fauci, I've seen Tony Fauci quoted now 3 or 4 times how they changed it for everybody. And if I ever get a chance, I have met him, talked to him again, I would say, Tony, not every place, but definitely within AIDS. And I think that one of the things why the activists are responsible for the fact that we have all these drugs is that our activist community tended to drive away from AIDS physicians and parts of the medical establishment who did not want to be guided by science, and drove toward AIDS people who would be guided by the science, who wouldn't put their own prejudice and their own judgment, in front of scientific fact. And because they did that, science has advanced in AIDS coherently. And so, Christopher Reeves once said, well, obviously while he was still alive, that what happens with spinal cord injuries is you study one kind in a cat and then a different kind of spinal cord injury in a guinea pig, right? So you can sort of see where that will go. Joe Biden formed the Cancer Institute or something, at Penn before he decided to run for president again. And what did he say? He said, you guys don't talk to each other. Well, in AIDS, they do, but it's entirely because of the activist pressure, I think. It's because the people who refuse to lay down and die, who absolutely refuse to give up, right, on the science front, and then on the other, on the sort of the general, your rights front, people like the late John Bell, who was a prison activist, an AIDS activist, and who was the founder of Project Teach Outside, who used to say to people, half of your rights haven't been invented yet because you weren't here yet to demand them. And I think that's the spirit that makes places like Fight possible. We make that, did they make places like Fight possible? And I think that's, that's the spirit in which we need to go forward with COVID or with anything else that's going on.
And the organization is aptly named Fight. Absolutely love it. And of course, please donate, because Jane, you gotta say that this costs money to do the work that you are doing, especially in the age of COVID.
Yes. Please donate. We've got a button on the website. You know, if you can give us, you know, if you're from someplace that has actual PPE, that's great. But you know, yeah, I mean, we can't do this without you. And I think one of the other things to keep in mind about individual donations and small foundations and all of that, you know, most of the money that comes to us from government limits what we can do with it, and we can't control what the agenda is. You know, it's like you ask for the money that's as close as possible to your own agenda, but we can't really. And if we have individual donations, you know, and you know, like some of the money we have, but mostly it's individual donations. If there's some need that we think really needs to be fulfilled in the community, then we have the money to do it.
Yeah.
And that's where the difference comes. And that's where we need it, you know.
Thank you so much. And with that, Jane Shull, thank you so much for this conversation about the history of Fight. There's a lot of fight still in the organization.
Oh, yeah.
And I wish you all luck and Godspeed in your mission. And please donate to the organization as it continues its great work. And there's a huge need for PPE. So any amount helps. You can go to fight.org. My name is Cherry Gregg. I am the community affairs reporter for KYW News Radio, and it's been my pleasure to moderate this discussion. And thank you all for being here this evening.
Thank you, Cherry.
Thank you. We're now adjourned.